Before COVID-19 began threatening vulnerable nursing home residents, several Central Texas facilities had already failed to follow federal guidelines on infection control and prevention. KXAN investigators dug through health inspection records to find many of the homes with these deficiencies are now reporting coronavirus cases. Our Avery Travis takes a look at the numbers.
A lot of it's very basic: cleaning hands, clean environment. If a patient does have an infection, that is treated properly and they get placed in the right isolation so it doesn't get spread to another.
Basic but life-saving precautions the Centers for Medicare and Medicaid Services require facilities to have to protect residents. Yet federal health inspection records show nearly 30 Central Texas nursing homes had at least one deficiency in the area of infection control over the last 3 years. And more than half had multiple infection control deficiencies. Now several of these homes are reporting cases of COVID-19, and experts say they're not surprised.
If you've been cited for basic infection prevention, then I would suspect that would increase your risk.
But Connie Steed with the Association for Professionals in Infection Control says outbreaks can really happen anywhere.
Even good facilities, because someone can bring it in. You can have a carrier, somebody that is asymptomatic, and they spread it and no one knows.
That's why she emphasizes the importance of testing all residents and staff, but also having a trained infection preventionist on site.
Making sure things get done.
New federal rules required every nursing home to have at least a part-time infection preventionist by November of 2019. But now the federal government is reviewing those rules, considering easing up on the requirements. Steed says that has her concerned.
You don't want to back down on this. This is pointed out as those simple things are extremely imperative, and we can't take them for granted anymore.
Avery Travis, KXAN Investigates.
The Centers for Medicare and Medicaid Services say the proposed rule change is aimed at getting rid of excessively burdensome regulations for nursing homes. The change also calls for facility-wide assessments to happen every 2 years instead of the current yearly assessments.
Those federal health inspectors inspection records also show 32 Central Texas facilities received deficiencies stemming from a complaint, and over the last 3 inspection cycles, 40 facilities were found to have multiple deficiencies in different categories. For example, not serving or storing food in a safe manner, or failing to ensure that there aren't accident hazards in the building. KXAN investigators have built this interactive map so you can take a closer look at which of these facilities had the most deficiencies. You can find that online now, along with more nursing home coverage. Go to KXAN.com and click Investigations.